Hi, my name is Catherine Dugan, and this is my case report on PTSD and the movie Catching Fire. I chose to look at Katniss Everdeen. She's the main character in Catching Fire. She's brave, strong, very reserved, and she lives in District 12 in a nation called Panem. She's selected to participate in Hunger Games, a competition that's fought to the death, as a fighter for the second time. She exhibits trauma, guilt, and trust issues due to her experiences in the first Hunger Games. It's set in a nation called Panem with the 12 districts that are highly controlled by the government and have living conditions varying from dirt poor to very extravagant. In the poor districts, people fight to survive harsh conditions and are often beat or killed by government officials if they fall out of line. Katniss struggles with PTSD, post-traumatic stress disorder. It involves reliving trauma through reminders, flashbacks, and nightmares. She was put through grim conditions in her first Hunger Games. She watched people die and had to kill others for her survival. The people of Panem understand her PTSD because they watched her in the first games through live stream. However, they treat her like a celebrity and they have high expectations without considering what she's going through and the disorder that she experiences. If she went to a therapist in Panem, they would most likely tell her that her issues were not severe enough to need help, and she would probably just be told to tough it out. There are a few resources in District 12. One cannot afford to be set back from the rest of the community. I think PTSD is much more recognized in cultures today. However, many still struggle with the stigma of toughing it out. They place little importance on mental well-being, especially when people are in highly controlled situations. Without access to self-determination and the resources necessary to sustain independence, people are vulnerable to not just traumatic exploitation and violence, but also the traumatic loss of their intimate relationships, their families, their way of life, and their values. Many stigmas and issues revolving around PTSD in these cultures are due to lack of education and resources, making it difficult to get treatment and spread awareness about the severity of the condition. One evidence or symptom of PTSD that Katniss experiences is flashbacks and nightmares. She frequently has flashbacks to her traumas and relives them. The DSM-5 recognizes intrusion symptoms like these as very common reactions to PTSD. Commonly, the individual has recurrent, involuntary, and intrusive recollections of the event. The emphasis is on recurrent memories of the event that usually include intrusive, vivid sensory, and emotional components. These episodes, often referred to as flashbacks, are typically brief but can be associated with prolonged distress and heightened arousal. This is displayed by Katniss when she goes hunting in the woods. She goes to shoot a turkey, however, when she releases the arrow, she's brought back to the games. She sees her surroundings as the arena, and rather than seeing a turkey, she visualizes Marvel, a tribute or a competitor that she killed in her first Hunger Games. She gets overwhelmed and panics at all the memories that are all of a sudden brought to the surface. She's unable to snap out of it as she relives the scenario. The National Institute of Health states that this behavior soon leads to impairment of the ability to function in social or family life, and this can damage relationships, careers, as well as one's ability to parent. Another symptom that Katniss experiences is hypervigilance and startle responses. Following the games, Katniss is constantly on edge. Loud noises and sudden movements bring panic. This is acknowledged in the DSM-5 that individuals with PTSD may exhibit irritable or angry behavior and may engage in aggressive verbal or physical behavior with little or no provocation. Katniss constantly being on edge can be explained as a heightened vigilance for potential threats, including those that are related to the traumatic experience. An example of this is at the beginning of the movie, when Katniss first returns to District 12 and is approached by her best friend Gale in the woods. Although she's known him her whole life and trusts him, she turns towards him with her bow drawn, ready to shoot him. This is because she views him as a threat because her PTSD has caused distrust of her surroundings. One can argue that Katniss displays the shattered assumptions theory, where someone has preliminary assumptions, including the world is benevolent, the world is meaningful, and the self is worthy. After trauma, the foundation for these inherited symptoms is weakened or shattered. This explains why Katniss lives in fear, having distorted assumptions that the world is violent and full of threats. A symptom that she does not exemplify is dissociative amnesia, where one cannot remember certain events from their trauma. Some block things out. Stimuli associated with the trauma are persistently avoided. The individual commonly makes deliberate efforts to avoid thoughts, memories, or feelings. Others suffer from severe memory loss, not being able to recall anything at all. Katniss does not struggle with this. In fact, she's often haunted by the events of her trauma. And additionally, for diagnosis of dissociative amnesia, there are no other symptoms of PTSD, meaning that Katniss could not be diagnosed because she does have a multitude of other symptoms of PTSD. For treatment, I would propose that Katniss should participate in cognitive processing therapy and cognitive behavior therapy. These treatments are effective for a case of PTSD because they help shift cognitions from negative to positive. This is by modifying appraisals, cognitive restructuring, and exposure. It helps the individual assimilate their thought process, which can help reverse their distorted interpretation of the world. These treatments are very successful, especially in veterans, and exposure therapy and cognitive restructuring have proven to be more effective in reducing PTSD symptoms in comparison to relaxation techniques. There are a few ethical concerns for these treatments. However, some may be concerned that the guidelines of trauma-focused treatments could pose a risk to some patients because of the distress elicited by focusing on the trauma memory. It may limit providers' ability to be reimbursed for other types of treatment, or they may believe that RCTS led to false conclusions. Katniss's district is highly controlled by the government, and most people are extremely poor, fighting to survive in harsh conditions. There are very few resources in District 12, and one cannot afford to be set back from the rest of the community, such as requiring therapy or treatment. I think Katniss's portrayal of PTSD in Catching Fire was accurate. The traumas were detailed in the first movie, giving the viewers context and background information to refer to. They understand what she's going through and the reasons behind her thoughts and actions. In the second movie, her scenes of her experiencing PTSD are very vivid. They don't hold back. They provide a realistic view of what the disorder looks like. However, the movie is pretty dramatic, so some scenes are blown out of proportion. Overall, however, for the most part, they're an accurate representation of PTSD. This influences our understanding by portraying what exactly PTSD entails. There are many aspects of the disorder that I did not know about until watching the movie. When I paid attention specifically to Katniss and her struggles, I learned a lot more about what it looks like to live with PTSD. Portrayal of disorders in film helps spread awareness and spike emotional reaction when our favorite characters or shows display something like PTSD. Many people don't like to conduct research, however, watching films are easy. It's a great way to reach a variety of audiences and spread knowledge about psychological disorders.